since the beginning of January 2022, when the global outbreak started, those additional countries mean that the number of countries affected has risen from 11 to 15 in just a short period of time. And that would be Burundi and Kenya and Uganda and Rwanda. This also is the first time that we've seen the transmission of a new strain of Mpox outside of the eastern DRC region, namely meaning clade 1b into Kenya, Uganda, and Rwanda. We certainly assess that the overwhelming proportion of the cases on the continent, about 9 out of 10 of all cases that are identified, are occurring within the Democratic Republic of the Congo. And I should also add that we do think that there's increasing concern and an increasing need to really ramp up the response efforts within Burundi in particular, in addition to the Democratic Republic of the Congo. Vaccines are one among a large number of tools available to us to make sure that people can help protect themselves and protect their communities. With vaccinations, we're really excited to be working very hard with countries at this moment in time, with national regulatory authorities, especially following the activation of what we call emergency use listing. The World Health Organization Director General has opened this emergency use listing procedure, which will enable rigorous and efficient review of what we call product dossiers that are submitted by manufacturers. And what this means is that we can work with countries through their regulatory review of Mpox vaccines, and also allows Gavi and UNICEF to engage in vaccine procurement. So it speeds up the timeline for getting safe and effective vaccines into the country. But really critically, the WHO is already working to support country capacity to use approved vaccines once they arrive, because vaccines on the tarmac is not enough. Vaccines need to be turned into vaccinations in order to be effective. So we work with countries, we conduct rapid readiness assessments to identify where there are capacity gaps, and we're already doing the work that is necessary to fill those gaps and make sure that ultimately we are here to get people protected and to save lives.